let's hear from Marcus, who's going to tell us a little bit about the situation in British Columbia, and also some of his experiences working as a health promotion case manager at AIDS Vancouver, which reminds me, I didn't do your bio yet. I'm sorry. Marcus Sanzi graduated from his BA in psychology and specialization in psychosomatic medicine at Faculty of Health Science at the University of Sao Paulo in Brazil, where he also worked at the Hospital of the Faculty of Medicine of University of Sao Paulo, specifically with LGBTQ HIV prevention. He also joined the HIV prevention team this year as the health promotion case manager, working with gay and bisexual men at AIDS Vancouver. Marcus is a student member of the Canadian Counseling and Psychotherapy Association. He's going to tell us a bit about the situation in Vancouver and some of the stigma his clients face. Thanks, Marcus.
Cool. Thank you. Most of the questions that Max raised is pretty much what is happening in Vancouver as well. So I'm not going to extend much on that, but I'm going to kind of walk through how the process are somehow similar but slightly different in the same way. So I'm going to start talking about 4 specific topics. Okay, so when it comes to being eligible, this is extremely related to your connection with your doctor, how you interact with it. And I'm going to explain a little bit more what that means. Also, having, how did that work over here? So having a doctor willing to prescribe the medication is fundamental. This is going to facilitate your whole access to PrEP. Truvada is an off-label medication. I think that you gave an explanation about that, and there is a liability within the doctor in prescribing an off-label medication. PrEP is not covered by any means for any health authority, neither, and they are here today, just saying. Sorry, it's true. Through my experience, I have noticed that there is a lot of stigma related with PrEP, and I will be presenting a few aspects that I've been noticing with my clients, okay? So when it comes to the same aspects that Maxine was talking about, what do you have to have in order to be able to get a prescription? There is a few things that it's also considered in Vancouver. So, but those are not as strict as you are saying. In Vancouver, if you do have a good relationship with your doctor, the doctor not necessarily needs to go there and say, well, okay, so you are at risk and you will get a prescription. No, he kind of knows what it is, he or she. Knows exactly what's going on in your life and know the benefits of a PrEP. So having this relationship with your doctor is extremely fundamental. It breaks a lot of barriers. But one thing is for sure is the fact that your doctor can consider any of those in order to identify someone that is at risk or will be benefited by Truvada. So specifically, you will be labeled with one of those aspects. And this is a common practice right now within the healthcare providers. And so you need to assume that this conversation is happening as well between them. So I have a client there, I prescribed PrEP. So the other doctor knows that you are under those categories, right? So he works with this population, the at-risk population. So things that I always talk to my clients is the fact that how comfortable you are on disclosing those informations to your doctor and how your doctor will see. So that's why I believe that having a very good relationship with your doctor will facilitate access. So if you do have a family doctor, as I said, you have to be comfortable talking about your sexuality, and it's something that is going to come up very abruptly on a conversation if you've never had that type of talk. So things that I motivate my clients to think about, am I comfortable with my sexuality? These questions are important because you determine if you'll be eligible or not. Also, he will be collecting specific behaviors and specific information about you that you might not feel that it's convenient to be talking to your doctor about it. So things are very delicate in that matter. Once again, Truvada, it's an off-label medication. There's a liability that some doctors are afraid of. And there is a specific guidelines that the doctors also need to follow in order to prescribe the medication. As Maxine was saying, there is a blood test, there is liver and kidney test that you have to go through. It is a medication that we will prescribe every 3 months, and you have to go back to your doctor. So there is that kind of sense of, you living towards that aspect of your life, right? If you don't have a family doctor, generally we assist clients to find a family doctor or to connect with a nurse practitioner at Health Initiative for Men, and we go from there. And we try to lower the barriers as much as we can. But since there is a guideline, some aspects of the test, the HIV test, the blood test, and so on, those are mandatory. The other question that we ask is if you do have a health insurance. It is important because, as Jody was saying, the medication is not covered in Vancouver. So if you don't have your private health insurance, you won't be able to afford it. So it doesn't matter if you have the prescription, if you can afford it, you're not going to have it. And it's quite expensive. So things that I talk to clients very often when they express that they do have health insurance is, do your policy cover off-label medication? Some of them don't. Dealing with health insurance, it's not easy. Some of them are already providing guidelines for people taking PrEP, but others are making the whole process even more difficult. Knowing the policies of the plan, it's a key aspect to have access to understand the coverage. Some policies present a lifetime medication supply, which can impact the coverage of other medications, and that could be another barrier for you to access PrEP, because if you do have that, and eventually you have a different a life event that requires you to have a different medication, you might not going to be able to afford it. The medication is expensive. Some policies will ask you to pay out front, and then they will reimburse you, so you need to also consider your finances and see if you're going to be able to pay that. If you don't, some people ask me if they should get one. It's not as easy, but it's a possibility. As I said, the medication is expensive, can cost up to $900 per month. You can buy a private insurance. If PrEP isn't something feasible for you, then you should consider other prevention tools. But this is the part that I really want to talk about. It's the PrEP stigma. So I have a client who is 57 years old and self-identified gay man. He was telling me about when he was 20 years old, on his 20s, discovering his sexuality in the middle of the first HIV epidemic. So he expressed all the panic and the fear that he felt, which changed his sexual life forever. So many of his friends died, and he buried them. Now he has a PrEP prescription, but he never went to the pharmacy and get his medication field because he's still afraid that having condomless sex will kill him. So this is a real situation. It's something that it's vivid, and this is one part of the stigma that we need to also have that in mind. His doctor is very supportive, had numerous conversations with him around the efficacy of Truvada, but it's still not enough for him. I'm still working with him, and every time that he comes to my office, he brings the prescription and says, am I ever going to be ready for this? So I want to talk another example. I have another client that expressed how he feels about talking about PrEP to his friends. And one of them said to him that he doesn't want to be around him anymore. So when he asked why he's on PrEP, he said, because you might be a sex addict or something like that, and you are a whore, and this is not the type of people that I want to be around with. So I also hear from clients the expression, you are not a boyfriend material. I don't know if you guys ever heard this, that you're not a boyfriend material. So, and...
Well, we may have heard it for
right?
a number of reasons. Sorry, I couldn't resist.
It's okay. One night before I started grad school, I actually had life. So I don't know what that is anymore. So I was having dinner with a bunch of gay friends, surprisingly. And for some reason, the PrEP conversation started. And everybody knows I'm very open about what I do for a living. So everybody knows that I work with accessing and helping guys to access PrEP and with the health promotion program. And one of them came to me and said, you know, PrEP is only for guys who like group sex, gangbang, lots of facials, and all of that kind of stuff. This is true. And then he looked at me and said, right, Marcus? I was like, so I wasn't 100% sure if he was referring that to me specifically or if it was an association. But that's just an example. It's just to illustrate how the lack of information is affecting our community and propagating stigma around sex. We can choose to allow some people to tear down our community, or we can work together to build a strong and healthier community where all gay men are healthy, find pleasure, and have improved quality of life. So that's my presentation for now.
Thanks, Marcus.